So we are going to see what is say in this diagram, that is whatever this what is I am saying that what is there is a weakness in supports, weakness in supports. What you see, this is uterus, this is lower part of vagina, this is pelvic floor. What you see in this diagram, this is uterosacral ligament, and if this weakness in this, it can lead to the dropping down of the descent of the vagina. That is one reason. For this you should know this is the supports of the uterus. Stretch, and when it goes downward, see in this previous diagram, it is in the normal position here, it is normal position, but if this part becomes the weak, it goes downwards, there is a stretching of this, and whatever the nerves which are present over, it get compressed, leads to the backache symptoms. This is basic difference. This one pelvic floor, this is stretching, got it, it goes downward. That is meaning of uterine prolapse. So why we are saying this topic, because in the whatever the incidence of the prolapse of uterus is greatly reduced, because the reason behind it is the more of liberal use of cesarean section and the elimination of labors. We are taking proper intra care, then and then only the whatever the chances of this incidence of prolapse, it is greatly reduced. But if you do not take care proper of this intranatal care, that is during the delivery, the incidence of uterine prolapse is going to rise it. So now what are the clinical symptoms, how patient comes to you for the uterine prolapse? So commonest it is females presents with that of first which age group, if we say it, so commonly it is seen in the climacteric age group. Now what is climacteric age group? That is related at the age of some 45 years, 50 years, the females are more prone to this of uterine prolapse. That is common because menopausal age group is there. So age wise is that, and how is the clinically patient symptom says that there is something coming down from the vagina and there is a backache. Now question arises, why there is a backache? I have already explained in this diagram. When there is a stretching of this, the nerves get compressed, and whatever the nerves, this pelvic area drains into the what there is supply, it is at the back, solar plexus. This leads to the not solar plexus, at the sacrum area, and leads to the backache. Now second, increased frequency of micturition. Again, what is the reason behind it? What we show in this diagram, when there is a uterine prolapse, the next part, it is the bladder which is present here. Bladder. This is retroversion. When it is antevated, when it goes downward, it compresses the bladder, and the capacity of the storage of capacity, it is get decreased. And if example, if the normal capacity is that of some 2000, a normal 1.5 liter per, but when the pressure it is on the lower part, the capacity of the bladder it is get decreased, and it leads to the increased frequency of micturition. That is the reason behind it. Then a bearing down sensation, that is female says that something coming down, something bear down, something heavy sensation in the lower part of it, the genitals. There is a stress incontinence. What is meaning of incontinence? There is a normal for urination, female is having control over it, but what is meaning of stress? If patient coughs, there is a urine passes from it, that is called as stress incontinence. Continence means control, incontinence means there is no any control. And but obviously there is a coital problem, difficulty in the sex, or difficulty in voiding urine, that is passing of the urine. These are the symptoms which are related part of it. Now next we are going to see what are the types of uterine prolapse. Just see over here. So clinically it is divided into two parts. Which parts comes in? Whether it is the uterus goes downward or whether it is the vagina gets prolapsed. There are two situations can take place. Just see in this diagram. If we see, this is how the uterus it is. This is position. This is fundus of the uterus, body of the uterus. Then this part is the cervix of the uterus, and this is the vagina of the uterus. So what is, if this part goes downwards, then it is called as a uterine prolapse. When this part goes downwards, then it is called as a vaginal prolapse. And this again it is divided. Got two types. If this goes downward, That is how I shown in this diagram. This is uterine prolapse when uterus goes downward, and second part it is vaginal prolapse. This lower part, that is called as vaginal prolapse. So uterine prolapse again divided into two parts. How it is divided? That is uterovaginal prolapse and vaginal uterine prolapse. What is the clinical difference between in that? Which part starts first? When uterus goes downward in this way, in this fashion, and again vagina goes downward. So which one is starting first? If uterus is starting first, then it is called as uterovaginal prolapse. And second variety, when vagina goes downward. What you show in this diagram? Which one started first? Vagina first, and then uterus. Then this is called as a vagino-uterine prolapse. Got the difference? First, which one? If uterus started first, that is there is a pushing this way, and this is pulling. Push and pull. Uterovaginal prolapse, vagino-uterine prolapse. That is which one is starting first. And second variety is that of vaginal prolapse. What is vaginal prolapse? As we know that relation point of view, if this part is the vagina, this is anterior portion, this is posterior portion, this is normal position. What you say in this diagram? This one. Fine. Again, fundus, uterus and vagina. This is anterior relation, this is posterior relation. And what we say in front structure, it is the bladder forward, then urethra, and the back side the structure, it is the sigmoid colon. So depending upon the which part it is get prolapse. Anterior, this is anterior vaginal wall, this is posterior vaginal wall. From the name you can adjust it. If this parts get prolapse, what you show in this diagram, if this parts get prolapse, then it is the part which is close to, if imagine this is the bladder and lower part of the urethra. Bladder, what we use the word bladder? Cystitis. Inflammation of bladder, it is cystitis. So part which is close to it, it is called as a cystocele. If there is a prolapse of lower part of the vagina, then it is called as lower bladder, and near lower part it is urethra. So this is called as a urethrocoele. So how can you define as the cystocele? What is the cystocele? The descent of the upper 2/3 of anterior vaginal